lumbricals. Now, if the short note comes on lumbrical, what we have to mention again the origin, insertion of the muscle, nerve supply and the action of the muscle along with few characteristic features. For example, when we will write regarding the lumbricals, lumbricals is one of the intrinsic muscles of the hand. So, if you mention about it, it is one of the intrinsic muscles of the hand. And the lumbricals, they are 4 in number. In this first and second lumbrical, it is unipennate, and third and fourth lumbrical, that is bipennate. Now, if we draw a schematic diagram to show this lumbrical muscles, now in the hand we will be drawing this schematic diagram. This is the tendon of flexor pollicis longus. So this side is our lateral side and this will be the medial side. Then for the fingers we are having the tendons of the flexor digitorum profundus which are coming towards this, and this is the basically the muscle from which the lumbricals will originate. So the lumbricals, it is having a characteristic feature that it takes origin from the tendons of this muscle, that is flexor digitorum profundus. Now first and second lumbricals, which are unipennate, they take origin from the lateral aspect of first and second tendon of flexor digitorum profundus. So we will draw it like this. This is the first lumbrical. This is the second lumbrical. And we can very well see they are taking origin from the lateral aspect of first and second tendon, and both are unipennate. Now when we talk about the third and fourth lumbricals, they are bipennate, so they are taking origin from the adjacent sides of the tendons. So this is taking origin from the adjacent sides like this. This is the third lumbrical, and same way the fourth lumbrical is taking origin in the same manner from the adjacent sides. This is the fourth lumbrical. So now we can say the first and second lumbrical, they are unipennate. The third and fourth lumbrical, it is bipennate. And if we talk about the origin of these lumbrical muscles, they originate from the tendon of flexor digitorum profundus, and for first and second, they are taking origin from the lateral aspect of first two tendons of flexor digitorum profundus. And if we talk about the third and fourth, they take origin from the adjacent sides of third and fourth, or we can say adjacent sides of the medial three tendons. The medial three tendons of flexor digitorum profundus. The same we have drawn in the picture also. And when we talk about the insertion of this muscle, it crosses the metacarpophalangeal joints, and it goes slightly backwards, and it is inserted into the dorsal digital expansion which is present on the dorsum of the digits over here, and it is inserted to the lateral aspect of this dorsal digital expansion. So lateral aspect of dorsal digital expansion. Now regarding the nerve supply, the first and second lumbricals, they are having a different nerve supply, and the third and fourth, they have a different nerve supply. The first and second, it is supplied by the median nerve, and the third and fourth lumbrical, it is supplied by the ulnar nerve. And when we talk about the action of this muscle, it helps in the production of this action, and this is a flexion at metacarpophalangeal joint and extension at proximal and the distal interphalangeal joint. So flexion at metacarpophalangeal joint and extension at proximal as well as the distal interphalangeal joint. Now therefore, when we talk about the claw hand, the deformity of the claw hand, it is opposite to this action. If this muscle is paralyzed or it is affected due to injury of the nerves being supplied, it leads to a condition known as claw hand, in which the opposite of the action is there. In that we have the extension at metacarpophalangeal joint and flexion at both interphalangeal joint. So this is regarding the lumbricals.